Hey everybody, welcome to the answer session of this week's Ask Dr. Dan. Again, this week we were talking about the EmSella, which is the only FDA cleared device for all forms of incontinence. Again, it's the equivalent of 11,400 Kegel exercises, and you do it fully clothed. So let's get to the questions. Question number one, good question, does it hurt? The answer is no. It's a very weird feeling. It's contracting the pelvic floor, again, almost 12,000 times. So it's a little strange. It takes a little getting used to, but it does not hurt at all. There's no pain whatsoever. Question number two, how long until you see results? So unlike something like the Emsculpt, where you're looking for a cosmetic difference, the EmSella is strictly for strengthening the pelvic floor, and that happens very quickly. So in our office, we'll typically give somebody a 5-minute demo on the machine just so they can see it and see if it's something they're interested in. And almost always we get people that say that their incontinence has improved a little bit even with that 5-minute session. So over the course of treatment, people see almost immediate results. It's really, really cool, and it really changes people's lives. Third question, how long does it last? So everybody's a little bit different. So after 6 treatments, people feel really, really good. Some people may actually feel a little bit of weakness in the pelvic floor because you've hit it so hard with almost 12,000 Kegels 6 times over 3 weeks. But then that strengthening really happens over the course of the next 6 to 12 weeks. Some people will do a maintenance every 3 to 4 or 6 months, just depending on how they're feeling, and some people just want to keep that strength up and don't want to lose it. But the results are really long lasting, but I would say most people will do one tune-up treatment every about 4 to 6 months. Next question, is it only for incontinence? So it is only FDA cleared for incontinence. One thing that a lot of people found out while they were doing the EmSella is it also has some off-label benefits. It really helps sexual performance in both male and female. It actually helps with ED in quite a bit of men as well. They do a treatment called Gainswave for ED, which is like a shockwave therapy, but again, the patient has to be exposed. It's a really uncomfortable procedure where this is very comfortable, fully clothed, and great results. So yeah, just a little added benefit. And the last question is there anybody who can't have this procedure done? Really, one of the only contraindications to this procedure is if you have any metal in the area, so like a hip replacement or metal in your back, because again, this is like a focused MRI, so you can heat up that metal sometimes, so you have to be really careful with that. And anything electronic like a pacemaker or a stimulator, this treatment would not be recommended, and obviously if you're pregnant, it's not recommended. But other than that, really most people can have this procedure done. So any questions about the EmSella, please contact the office. Again, don't forget to like us on Facebook at Apex Center for Regenerative Medicine, on Instagram at RegenerateNJ, and on YouTube at Apex Center for Regenerative Medicine. Hope you all have a great weekend, and remember, don't operate, regenerate.